Hey all, welcome back to the Real Life Pharmacology Podcast. I am your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. Snag your top 200 study guide where I lay out important clinical pearls, adverse effects, and really some of the most highly testable clinical pearls with regards to medications in the top 200 list. So kind of a unique resource for everybody. Something you can get simply by subscribing to the blog there at reallifepharmacology.com. All right, so today's drug is going to be Abacavir. Brand name of this medication is Xiagen, also abbreviated ABC. And this drug is used in HIV management. It does also come in many pill combinations, so you may see various drug names where it actually is in a combination of pills, which is important in HIV therapy because it helps reduce pill burden and improves compliance, which helps reduce resistance and all sorts of different good stuff in the management of HIV there. It is classified as an antiretroviral agent, a nucleoside reverse transcriptase inhibitor. And if you remember how some of these drugs work, mechanistically, remember that it is a guanosine analog, and it gets phosphorylated in the body and actually competes with natural substrates to inhibit reverse transcriptase. Now, also, if you remember, HIV gets into CD4 cells, and it uses its own reverse transcriptase to change its own RNA into DNA. That's why it's called reverse, because it goes from RNA to DNA, which typically we go from DNA to RNA in many normal biological processes. But this virus is different in that it uses this reverse transcriptase enzyme, and ultimately it incorporates that DNA into the CD4 cell nucleus, which obviously, as you could imagine, can wreak havoc on the body and increase risk for opportunistic infections and all the negative things that go along with immunosuppression there. Now, adverse effects. One of the most unique, I think, and important things to remember with Abacavir, certainly a highly testable clinical pearl, is hypersensitivity reactions, and there actually is a boxed warning on that. Patients with the HLA-B 5701 allele are at higher risk for hypersensitivity reactions, and we actually test for this to ensure that it's safe for the patient, or safe as we can make it, safe for the patient to take this medication. So again, with that HLA-B 5701 allele, this drug is contraindicated. So definitely important to remember that, and it's definitely going to be a monitoring parameter, or we'll check through genetic testing if they have that allele before we're going to start Abacavir, so we don't risk hypersensitivity. Other adverse effects, generalized symptoms like GI upset can happen. Rarely you may see some CNS changes as well, maybe insomnia or sleep changes, dizziness maybe. And also lactic acidosis and hepatomegaly are potential adverse effects with Abacavir. Now, when I think about this clinically, I'm looking out for maybe patients with a history of liver disease, or maybe at risk for liver disease, that may increase that risk of liver concerns, liver problems with the medication there. Also, I take a peek and see if they're on other higher risk medications that may cause liver impairment as well. So a couple things I look for there. Also, there has recently, I think, been a little bit more information on possible associations with negative cardiovascular outcomes like MI. Now, these are just associations, so I'm always kind of cautious with associations because it doesn't necessarily mean causation. But I think it does allow you to bring up a good education point with patients for sure, that we maybe get a better handle on some of those modifiable risk factors for cardiovascular disease, whether it's smoking or cholesterol or hypertension. Getting those risk factors under control can obviously help lower our risk of MI, and in particular maybe in a patient on Abacavir. So I think it's something to look at, something to think about. If there's other options available that maybe don't have that association in a higher risk cardiovascular patient, it might make sense to, or it might be one reason to look elsewhere towards a different agent there. I did want to mention administration, so GI upset. Probably not crazy common, but if it does happen, Abacavir can be given with or without food. So that's always a nice thing that we don't have to necessarily time that at a specific time around eating and stuff, which can be sometimes tricky for patients depending upon their lifestyle and what they have going on. Monitoring parameters, I did want to touch on that. So mentioned hepatomegaly risk, so LFTs certainly might be monitored. There are some, potentially rare blood disorder changes that have been reported and associated. So CBC might be monitored. Obviously, with HIV, we're going to want to monitor that immune function as well there. Lipids, hyperlipidemia. Monitoring for that is important with Abacavir. And then, of course, we're going to do our, regular routine HIV labs as well, looking at those RNA levels and looking at CD4 count. All right, so let's take a quick break from our sponsor, and we will finish up with drug interactions. If you're in the market for Pharmacist Board certification study material, like NAPLEX, pharmacotherapy, ambulatory care, geriatrics, medication therapy management, go check out meded101.com/store and support our sponsor. In addition, if you're a nurse, physician, med student, PA, nurse practitioner, we've got a ton of resources at meded101.com/store. Various Audible books, paperback books, ebooks, lots of case studies, clinical pearls for various things. A couple of recent releases. I've done a guide on drug-food interactions, as well as a specific guide on drug-drug interactions. The book on drug-drug interactions in primary care, that you can get at audible.com for free. I've got the link right through meded101.com/store, so go check that out. And if you've never had an Audible book before, you can get that for free. So go scope it out, all at meded101.com/store. All right, so finishing up on drug interactions, Abacavir fortunately doesn't have a tremendous amount of drug interactions, so that's great. One of the big reasons why it's not terribly bad in this aspect is because it avoids the CYP pathway. It doesn't go really through CYP3A4. It doesn't go significantly through 2D6, where a lot of other drugs impact those enzymes. So that's certainly good. What I'm potentially looking out for is additive effects from other medications, whether that be GI upset, liver toxicity risk if we've got other meds on board that may exacerbate that. Also, lactic acidosis. The first common medication I think of course, is metformin. If we've got risk factors for that lactic acidosis, and we're on Abacavir as well, which has been reported and has the potential to increase that risk. Those are a couple of things that I'm looking out for as far as additive effects with drug interactions. There are a few kind of oddball ones that may lower concentrations of Abacavir. Methadone's kind of a unique one. orlistat, which is a drug used for weight loss purposes, well known for causing loose, oily stools. Basically prevents the absorption of fat in the gut. Those two, methadone and orlistat, can lower drug concentrations. Protease inhibitors, this is one that you might see a little bit more often, or at least might notice. Just recognizing that protease inhibitors may lower concentrations of abacavir is important, because in a patient who has HIV, you may see protease inhibitors obviously used in combination with abacavir. So important to remember that. I would say, any of these interactions, probably not strongly clinically significant. I mean, you likely wouldn't avoid using them together. Now, obviously, if you started them and you noticed a poor response to abacavir or increased progression of HIV in the disease state, then it's like, okay, yeah, you might go do something different that way, but you probably would mostly monitor these drug interactions for the most part there. All right, so I think that's going to wrap it up for today. If you enjoyed the podcast, go leave a rating, review on iTunes. Also go to reallifepharmacology.com and take advantage of that free 31-page PDF. If you want to reach out to me, you can find me at mededucation101@gmail.com, or LinkedIn is probably the social media platform I'm most actively on to track me down. I thank you so much for listening today. I hope you enjoyed it. Hope you picked up a few clinical pearls, and I hope you have a great rest of your day.